In today's video, we'll discuss about metoprolol, its uses, side effects, warnings, dose, etc. Metoprolol is a beta blocker that affects the heart and circulation. It is mainly used to treat angina and hypertension or high blood pressure. This medication helps to lower your risk of death or needing to be hospitalized for heart failure. Metoprolol injection is used during the early phase of a heart attack to lower the risk of death. Now let's discuss some of the warnings that come along with this. You should not use metoprolol if you have a serious heart problem, severe circulation problems, severe heart failure, or history of slow heartbeats that caused fainting. Tell your doctor if you are pregnant or planning to become pregnant because it can cause serious complications. Let's discuss the dose. Usual adult dose for hypertension is, in the case of metoprolol tartrate immediate release tablets, the initial dose would be 100 mg orally per day in single or divided doses. And as for the maintenance dose, 100 to 450 mg orally per day. As for the metoprolol succinate extended release tablets, the initial dose would be 25 to 100 mg orally once a day, and the maintenance dose would be 100 to 400 mg orally once a day. Moving on to the usual adult dose for angina pectoris or chest pain is initial dose metoprolol tartrate immediate release tablets 50 mg orally twice a day, and for metoprolol succinate extended release tablets 100 mg orally once a day. Okay, and then the maintenance dose is 100 to 400 mg per day. Now, the usual adult dose for myocardial infarction is the metoprolol tartrate early treatment. Initial dose 5 mg IV every 2 minutes as tolerated for 3 doses. And patients tolerant of full IV dose, that is 15 mg, for them 50 mg orally every 6 hours starting 15 minutes after the last IV dose and continued for 48 hours. As for the patients intolerant of full IV dose, that is 15 mg, for them 25 or 50 mg orally every 6 hours depending on the degree of intolerance, starting 15 minutes after the last IV dose or as soon as their clinical condition allows. As for the late treatment, the maintenance dose is 100 mg orally twice a day. Next one is the usual adult dose for congestive heart failure. Metoprolol succinate extended release tablets 25 mg orally once a day, that is 12.5 mg orally once a day in patients with more severe heart failure. Double dose every 2 weeks to highest tolerated dose or up to 200 mg orally once a day. Pediatric dose for hypertension is metoprolol succinate extended release tablets 6 years or older. Initial dose is 1 mg per kg orally once a day, not to exceed 50 mg. Maximum dose is 2 mg per kg orally once a day. What are the side effects of metoprolol? Metoprolol may cause serious side effects. Call your doctor at once if you have very slow heartbeats, a lightheaded feeling like you might pass out, shortness of breath even with mild exertion, swelling, or rapid weight gain or cold feeling in your hands and feet. Now, some of the common side effects of metoprolol are dizziness, memory problems, depression, confusion, tired feeling, trouble sleeping, diarrhea, etc. What is the difference between metoprolol succinate and tartrate? There is not much difference. Both of its content are the same. The main difference is that metoprolol tartrate is only available as immediate release tablet, which means it must be taken several times a day. Whereas metoprolol succinate is an extended release tablet which can be taken once a day.